Hello, everyone. Hi, good morning, good evening, good afternoon, or good night. My name is Osama Khan, and today I'm going to take you on a quick trip around the world. The topic is International Human Resource Management in Healthcare, or in other words, short form IHRM for short. We will explore four countries today, and they are USA, China, South Africa, and the last but not the least, Australia. And how exactly these all countries manage their healthcare workers. So let's go. Slide number two. So what is exactly IHRM? It means managing people in hospitals and clinics, but on a global level, international level. Every country, every single country has different cultures, rules, and healthcare systems. IHRM helps adjust HR strategies for each region. It makes sure people are treated fairly, trained well, and healthcare stays strong. But it's not easy. Different countries have different challenges. Slide number three, IHRM practices in USA. Let's start with the USA. Here, HR focuses on strategic goals like making patients happy and supporting staff well-being. They use technology to hire people, train staff, and manage work shifts. Cloud systems help organize big hospital teams. HR in the USA cares about staff comfort and flexible work hours. The next slide is about the evaluation practices in USA. What works well? Let me ask you. The staff are resilient and work great in tough situations. HR supports them with training and stress programs. But there are problems too. It's hard to hire in rural areas like villages, for example, which are not closer to the main city. Many nurses are overworked. Laws like HIPAA makes things complicated. Best hospitals are mentorship and data to fix burnout and make smart decisions. The next country on the list is China. Now, the Chinese government controls most healthcare, HR here. They want fairness and equal access for everyone in the country. They set staffing targets and give training, especially in poor areas. They use data to check how many nurses and doctors they have. It helped increase staff numbers across China. Now, evaluation of practice in China. The staff follow the government's plan very closely. They multitask a lot, like doing both vaccines and patient care at the very same time. But still, the rich areas like Beijing, for example, get more staff than villages. The planning is still very slow, and poor areas still suffer to this day, currently as we speak. What's the solution and the best practice for this? To train the workers for poor areas and make them stay for fewer years. They use smart tools like Lorenz and Genie to see which areas need more staff. Next country. Now let's fly to South Africa. Since 1994, South Africa have worked very hard to make healthcare equal for everyone in the country, from top to bottom, low to high. The doctors must work in poor areas first, as it is a first priority. They give extra pay, money, packages, incentives to those in rural areas which are far away from the main city. They also track every single thing using digital systems like district health information system. All these efforts helped, but still not enough staff in villages. Now the evaluation part. The staff are tired, they don't feel heard, Managers don't always support them, and 25% of workers want to quit every single year. There is not enough leadership and job clarity, but there is still good news. They made a national strategy to fix all these issues by implementing more training, better conditions, and honest policies. Now, the last but not the least, the final country in our list, which is Australia. Here, the HR cares about fairness for both cities and remote areas, which is not accessible to go or easy to go, you can say. They use performance management systems to track goals and feedback both at the very same time. They also plan very carefully where to send their staff, especially to rural zones. Sometimes too many rules make staff feel stressed and untrusted, but in rural areas, people feel more connected and happy and stress-free. Best hospitals involve staff in decisions and give positive feedback. They also give incentives to work in faraway places which are not near to the main city. Now, this helps keep the workforce strong and together. We head towards the comparative analysis, which is comparing all these four countries. Uh, the first country, USA. Now, America is very strong in technology and flexibility, but always struggles with burnout. China, on the other hand, has grown its staff numbers, but obviously the rich areas get more benefits, which is not good. South Africa pushes for fairness for everyone, whether be it the rich or the poor, but has weak HR systems. The last but not the least, Australia. It tracks performance very well, but control can reduce motivation. The next slide. All countries want fair care, but face different challenges. Digital tools, data, and good HR planning are very important. What's the main lesson that we get from this? The moral of the story, I say. You must respect local needs, but also keep global goals in mind. Balance is the key, 50-50. Now we come down to the conclusion and future trends in IHRM globally. The world is changing fast, everything is changing due to the advanced and latest technology. Future IHRM will follow and focus more on digital tools, fair staff distribution, cultural training, and most importantly, keeping healthcare workers happy. Now we come down to the end, so slide number 14 and 15. These slides list all sources used, and I would like to thank to the authors and researchers, writers, bloggers who have helped us understand global IHRM today. And that's about it. Um, I would like to thank you so much for listening. I hope this made global healthcare HR easy to understand. If you have any questions, I would love to answer. You can just comment down below the video. And bye for now.